Coming up on Mayo Clinic Q&A. A cancer diagnosis can be a frightening experience for anyone, but for adolescents and young adults, that experience can also bring some unique challenges. Some receive care in pediatrics, but the majority are cared for in adult cancer systems, with many facing issues with access to appropriate care. Today we'll look at the Adolescent Young Adult program at Mayo Clinic and learn how these individuals are being supported and treated throughout their cancer journey.
With this being an underserved, under-recognized, underdiagnosed population, for the most part, they really are the poster children for facing disparities when it comes to their diagnosis and care. And so one of the biggest issues that we have to overcome here is that a lot of young adult patients have delayed time to diagnosis. And with delayed time to diagnosis, you end up with more advanced stage disease, you end up with different treatments being needed and more long-term considerations.
Welcome everyone to Mayo Clinic Q&A. I'm your host, Dr. Helena Gazelka. April 4th through 10th is Adolescent and Young Adult, or AYA, Cancer Awareness Week. It's an excellent time to discuss the unique challenges faced by people between the ages of 15 and 39 when they experience a cancer diagnosis. While some AYA people with cancer receive care in pediatrics, the majority are cared for in the adult cancer systems, and sometimes people in the group don't fit well with either patient population. Here with us to discuss this is Dr. Allison Rosenthal. Dr. Rosenthal is a Mayo Clinic hematologist oncologist who's developing a program at Mayo Clinic Cancer Center to meet the unique needs of AYA patients. Welcome to the program, Allison.
Thank you so much for having me, and I'm really excited to be talking about this topic as it's something I'm really passionate about.
I can imagine what a really interesting topic and what a difficult time for someone going through life. How is it different to be an adolescent and young adult or an AYA individual who's going through a cancer diagnosis?
Yeah, so I think that's the really important thing that we have to start bringing to light and educating people on, is that it is different, right? It's not the same as if you are diagnosed as a child or even as 10 or 12 years old. It's not the same as if you're diagnosed as a 55 or 65 or 75-year-old. And if you think about the kinds of things that people in this age group are going through, there's a lot of life transition happening there. So this group really has a lot of unique needs as far as psychosocial development, what they're going through as far as trying to find their independence, financial independence. Some of them are still in school, some of them are trying to start families. And so it's just, there's never a convenient time to be diagnosed with cancer, but particularly inconvenient in this group. And they often get overlooked because I think people just don't recognize that cancer is really common in this age population as well.
Are the cancers that are experienced in this age group different than what older adults or young children might experience?
So people of any age can get any kind of cancer, but you're absolutely right. There are some cancers that are more common in this age group. And while the numbers change periodically, I think the ones that are most common at this point end up being thyroid cancer, breast cancer, melanoma, blood cancers. And there's been a rise in the incidence of GI cancers in this group as well, for reasons I think we're still trying to sort out. But it is a little bit different. And so that goes, in the same vein as, we have to educate people and have better awareness as to what affects this group.
So if these individuals might be experiencing the same cancers as someone who is older, are the treatment strategies and approaches to how to care for them different?
It can be. So as you alluded to in the introduction, some of these patients do get treated in the pediatric setting. And so that's largely our later teenage patients. However, there are some pediatric programs that are really comfortable taking care of people even up to the age of 25. And I specialize in lymphoma. So what I know the most about are blood cancers and the differences in treatments there. But there is a huge difference in what would happen if you were 18 with, let's say, Hodgkin lymphoma, which is common in young people, and you get diagnosed and treated at a pediatric center versus if you come to an adult center. And because those treatments are designed differently and the toxicities are different in the short and the long term, one of the real issues we have with this population is that sometimes we don't speak the same language. So if a pediatrician or a pediatric oncologist calls and says, I have this patient, here's what I'm thinking, what do you think? I have to look up the regimen they're talking about because we just don't talk the same. And so one of the things we're hoping to accomplish with having this group and having better coordinated comprehensive care and transition from peds to adults is making sure that we are all on the same page and understanding, what we think might be the best treatment for them, no matter what age they are.
Allison, here at Mayo Clinic, we are very aware that disparities exist in healthcare and that they can really affect the treatment that an individual receives. And we are working hard to diminish those disparities and resolve them. Are there disparities that are present in this age group when they're going through cancer therapy?
Sure. So this is really important also. And some people who are studying this age group, in particular, young adults who get diagnosed with cancer, are really looking at this now and how to improve this, because with this being an underserved, under-recognized, underdiagnosed population, for the most part, they really are the poster children for facing disparities when it comes to their diagnosis and care. And so one of the biggest issues that we have to overcome here is that a lot of young adult patients have delayed time to diagnosis. And with delayed time to diagnosis, you end up with more advanced stage disease, you end up with different treatments being needed and more long-term considerations. The other thing is that there is a really big gap in young adult patients with cancer having access to appropriate care. And that means both age-appropriate support for what they're going through, but also centers. There aren't a lot of centers, or there isn't a good way to find a center that has expertise, particularly in taking care of this population. And then I guess the third thing that ends up being really important is that this population really experiences some challenges with being insured properly, right? No one ever plans for cancer. Nobody ever thinks, I'm going to get this plan so that I can have good coverage if I get cancer. But one of the things that happens in this age group is they age out of being covered by their parents. Or maybe they've already gotten married and started a family, and so now they're on their spouse's insurance or something. And so one of the other disparities they face is being underinsured or inappropriately insured. And so if you lump that all in with all of the social determinants of health that we've all been talking about, recognizing as being barriers to good care, you take the racial, the ethnic, the socioeconomic challenges that any patient with cancer may face, and then put it together with all the challenges this unique population faces, they really have a lot of disparities that they face. And so we have a lot of work to do in this space.
Wow, that is a lot, Allison. So how does the adult or the adolescent and young adult cancer center program that you're putting together for Mayo Clinic help meet some of those unique needs?
So this is really exciting that we finally have gotten the attention of enough people to understand that they have unique needs, and that a program needs to be built around those needs. And so kind of the holy grail, or the perfect, the ideal program that we're hoping to put together keeps all of that in mind. So it combines what we do well at Mayo Clinic, which is multidisciplinary, state-of-the-art comprehensive care for cancer patients, and then pairs that with things that this group needs. So ideally, we'll have a nurse navigator that all the patients will meet as they come into this system, social worker dedicated to AYA issues and needs, health psychologists. And it'll take some time to build all this up and have all the right people in place, but we'll also need things like financial counselors, people to help with the insurance concerns, vocations counselors. So as people go back to school or have school interrupted or trying to find a job. And then, of course, we'll have to make sure that what's built into this is a very clear, concise, and coordinated transition from pediatrics to adults, because that's one of the other challenges we face here is some of these kids will be diagnosed at the age of 16 or 17, and they'll need adult care soon. And so we have to make sure that we're doing everything they need in the short and long term to transition them to long-term care and follow-up as well. And the one thing that I left out of there that is, I probably also, one of the most important things is having survivorship care that focuses on the needs of these patients as they move forward. We're really fortunate that the majority of young adult patients who get cancer care are going to do well in the long term. There's going to be a lot of long-term survivors, but if we aren't paying attention to the long-term treatment side effects and the monitoring and maintenance of health behaviors and such that happen after a cancer diagnosis, then we aren't doing, the full service for these patients that they really deserve.
What role will clinical trials play in this?
Clinical trials are going to be critical to the success of this program and mainly to help improve outcomes. So one of the things that got the AYA group kind of into the spotlight as needing more attention, more dedicated attention, is that the outcomes for cancer care in the young adult population haven't improved nearly as fast as they have in pediatrics and older adults. And so clinical trials are really, the optimal way to improve outcomes. And one of the challenges, the big hurdles with this group has been that their participation in clinical trials has been really poor. And that's for a couple of reasons. One, there aren't a lot of clinical trials that address this entire age group. They happen in pediatric programs, they happen in adult programs, but there's not a lot of crossover in making sure that there are trials that encompass the whole group. Education. So these patients have, varying ideas about what clinical trials are for and what they mean to them. And then access to centers that are running them. Fortunately, that's all changing. So there are a lot of cooperative groups that are getting together now, both from the peds and adult side, to say, look, we really need to study this better, both from finding new treatments, new combinations that are less toxic, but also looking at things like behavioral interventions and physical activity interventions and ways to help manage some of the psychosocial effects that this has on people. So absolutely, clinical trials are going to be critical to the success of this program, and we're really looking forward to building that out as this program takes off.
What an exciting program. I just love hearing about this today, Allison. Incredible solutions that you're looking for to some common problems for people in this situation. When will the program be up and running?
So it's in its infancy now. We're up and running with the people that we have identified as kind of being champions in this space and interested. It's important, I think, to recognize that this program isn't going to take the place of anything that's already happening. It's going to serve as kind of a complementary set of support system, a complementary support system really for these patients. So they will continue to get all the excellent care they're getting in their disease-directed groups now, their disease-specific groups now, but this will be an added layer of support, mainly focused on, what the issues are specifically with this population so that things aren't falling through the cracks. And ideally, as everybody comes in, there's a needs intake assessment so they get connected with all the right resources right from the get-go.
That's wonderful. Thank you for sharing this with us today, Allison.
You're welcome. Thank you for having me. I'll talk about this all day long, any chance that I get.
Our thanks to Mayo Clinic hematologist and oncologist, Dr. Allison Rosenthal, for being here today to talk to us about adolescents and young adults with cancer diagnoses. I hope that you learned something. I know that I did. We wish each of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.